Hello, my name is Priya Prakash, and I am the founder and CEO of HealthSet Co. And today on our Take with Expert Talks, we have two health experts with us who are joining us today. We have Dr. Sameer Gupta and Dr. Sonia Lal Gupta. I'll just start by giving a short introduction for both of them. So Dr. Sonia Lal Gupta is a US board certified neurologist specializing in headache medicine and vascular neurology. She is the director at Metro Group of Hospitals and Metro College of Health Sciences and Research, and has co-founded Voice of Health, a credible platform for medical and healthcare advice. So welcome, Sonia.
Thank you. Thanks so much for having me here.
And a short introduction of Dr. Sameer. So Dr. Gupta is an interventional cardiologist specializing in complicated coronary, structural, and peripheral vascular procedures. He is the director of Umkal Hospital in Gurgaon and director of Cardiac Cath Lab Metro Group of Hospitals, and also a co-founder of Voice of Health. So welcome to both of you. Today, of course, the topic of discussion is COVID and coronavirus. And I know that both of you have been across media outlets really trying to get into, the questions that the regular public has about coronavirus. Of course, not all of us are specialists. And definitely, we are both, we're all not as highly qualified as both of you. So we really want to know some of the basics. And today, the kind of people who are watching this are families. So how I would like to go about this entire discussion today is to assume that you have an audience of all age groups. So we know that all our kids are watching us, today. We also have parents, we have grandparents. So basically families who are tuning in to really get to know more about COVID. Someone said recently that the biggest epidemic is actually misinformation. So I think in order to overcome the epidemic of misinformation, it's really great to have you guys with us today. So I would like to start off with the first question for Dr. Sameer. So Dr. Sameer, the most basic question, how does one know that they have COVID-19?
I think that's a very important question to begin with. And let me tell you, just because somebody has a headache or a fever or a runny nose does not mean that they have COVID. COVID typically, it's a viral illness. It's spread by this special virus called the coronavirus. And the name of the scientific name of the virus is the SARS-CoV-2. The disease it causes is called COVID-19. So that is just the basic of it. SARS-CoV-2 is the virus and COVID-19 is the actual disease. And some of the symptoms with this disease, as you have fever, you can have, you feel you have a little sore throat of sorts, and shortness of breath is something, and body aches. So these are, it sounds like they're very similar to the regular flu, but the thing with this is you have shortness of breath, and the shortness of breath really is what kind of differentiates COVID from other causes of fever and runny nose. Also, you have to use your common sense. If you are somebody who has allergies, the seasons are changing, spring is in the air, and you have a runny nose, it could just be that. If you're having stomach ache and you have diarrhea, and along with that you have fever, it is probably food poisoning. But these are some of the symptoms of COVID. And also now that we're on lockdown, some of the other things that hint towards COVID is if you have an exposure to somebody who has confirmed COVID. Right? If you're living in one of those hot spots and you have some of these symptoms. If you are somebody who has traveled, it's now the 15th of April and nobody's traveled abroad for almost a month. But if you have somebody who's had exposure to somebody who's had a travel history in the last 2 to 3 weeks, then chances are that it is probably, you have to go and think about COVID and start getting yourself tested.
Yes, I think these are some of the, basics that not many people know about, that coronavirus is actually the name of the disease and not the name of the virus itself. The virus is called SARS-CoV-2, which I think, not too many people know about. So, Dr. Sonia, you want to add to this?
Yeah, so basically, so coronavirus is actually it's a common cold virus. And within coronavirus, you have different types of virus. And that's why the infection is COVID-19. And the other symptom that I would like to add, what they've discovered is that people sometimes have an early loss of smell. So even if they have fever, a dry cough, and they just have, and they have this loss of smell, or they can't taste their food properly, that could also be a hint that, maybe you could have COVID, and yes, you have to get tested, you have to go to the hospital and see a doctor. The other thing I think everybody has to be careful is that adults and children might present differently. So that is something to keep in mind as well. Grandparents might present differently as well. Somebody is elderly in the family, they might present with more severe symptoms because their systems are not as strong as the younger ones. So that's why it is also important from that perspective to just look at everybody's symptoms in a separate way also and understand what they are having and then decide. Maybe for somebody who is elderly above 60 and who has diabetes or a breathing issue like asthma or COPD, they might have to go to the hospital earlier than later. If they have a fever, and a cough, maybe they go to the hospital sooner to get tested. But if somebody young, who's a child or, who's healthy otherwise, if they have symptoms, then they shouldn't get very scared that, oh, do I have COVID? Do I have COVID? It's better than you stay at home, you self-isolate yourself, put a mask on. But if the symptoms get worse, then go to the hospital. So I think that's the...
Yeah, I think that segues really well into the other question. And I just want you to elaborate on it. So what is that right time to rush to the doctor?
Yeah.
Because a lot of people say that the incubation period of this is anywhere between 10 to 14 days. Some people say 21 days. So how long should we really wait?
Yeah, so the incubation period ranges from 2 to 14 days, but most of the people on an average get symptoms between 5 days of exposure.
Okay.
And typically the symptoms in a simple infection also, let's say simple COVID-19 infection also lasts for around 7 days. So most of the people start feeling better. But let us suppose somebody has fever and the fever is just very high. Let us say the fever is continuously at 102, 103, which is also seen. Or there's a point where people are having difficulty breathing. So the key component that differentiates people from a flu or any other viral or anything else in COVID is people start having difficulty breathing, chest pain. Even younger people at times feel they cannot breathe. And that is a sign that their oxygen might be going down because they're not getting enough oxygen into the system, because maybe their lungs are not working properly. And that's the time they have to actually go to the hospital. They should not delay it at that point. They should go to the hospital immediately. And that is of extreme importance. The moment they feel that, yes, it's more than 7 days, my symptoms are not getting better, or I'm having difficulty breathing early on, then it's better to go to the hospital right away.
Yes, because, I was just going through the statistics and, I think people are usually very, very quick to panic. And with a lot of tests being available right now, every day you hear, about this lab has tests available, that lab has tests available, and testing is really opening up. Yeah. So there might be a lot of consequences of that people just want to get tested. So, yeah, Dr. Sameer, you were saying something.
Yeah, I was saying just in agreement with what she said, that also that if you think if you're sick and you're home and you have other people living at home, like she said, just self-isolate yourself. Okay. Wear that mask at home, even though we don't know whether you have COVID or not, right? But just wear that mask at home, self-isolate yourself. Stay, keep different small things. Keep a different towel for yourself. Be the last person to use the bathroom. So the bathroom can be cleaned after that. Don't be the first person, especially when you're taking a shower and the steam and all that stuff. So just use some of these things and, just keep that in mind, because there may be other people over there who can get affected in case you do have COVID, because we don't know whether you have COVID.
So, a lot of people say that this is, this is a disease that everybody, if only we all work together, we can actually contain it. It cannot be contained by one person alone. And being from a family where I know that I have elderly in the house, who might have had some pre-existing diseases. Every household today in India has certain conditions like heart disease, diabetes. Unfortunately, this population is more at risk. So anything special to keep in mind for the elderly at home? Any special way that we need to look after them?
I think for them, it's important they don't go out. That's the most important thing. That's where the lockdown becomes important. That, especially for the elderly, do not go out. Even our Prime Minister especially said that,
Yes.
So the elderly, please stay at home. Do not go out. And most importantly, if anybody else, like Sameer mentioned, in the family is sick, I think it's important to wear the mask and keep that 3 feet distance. If possible, actually a 6 feet distance. So just in general, I think at this time, grandparents and grandchildren kind of, that that lovey-dovey relationship that they share,
More
and
bonding.
and that bonding has to be from kind of a distance. You know, I
From
love
far.
you, Granny, I love you, grandma, but I love you from a distance for now because it's not worth it. Somebody might be asymptomatic, and maybe in their grandparents, the same infection will be very severe. So that's the reason, especially with their grandparents, they should keep that 3 to 6 feet distance whenever they can.
I think there's a lot of bonding going on at home, and all of us are spending more and more time with our family. So yes, I think it's important to keep that distance. Now, that being said, a lot of people are wearing face masks, and there is such a big, question around face masks. Face masks are sold out everywhere, right? I think even before the lockdown, the first thing to sell out was face masks and sanitizers. So people are in a frenzy right now, and there are many videos out there online where you can just take a cloth, measure it, make your own face mask. And if you saw our PM address, he first had his scarf up like a face mask, and then he put it down. So can you help us bust this entire dilemma? So Dr. Sameer, maybe goes to you. So should we use face masks at home, outside? When should we use them?
So the controversy with face masks is far from over. The literature is varied, the jury is out there, but everybody, when they go out, should try and wear a face mask. Let's be clear. Everybody, when we go out, should try and wear a face mask. There are multiple pros, there are multiple people who are saying yes and no, but just wear a face mask, especially when you're going out. When you're inside the house, if you are somebody who's an older person and you have you have somebody with an infection at home, or you are the person who's infected himself, then please wear a mask at home, because you don't want to expose other people to masks. I'm not sure, you can give whatever statistic, or the virus is 95%, 90%, that's all fine, but wear a mask at home. And the question is which mask to wear. The N95 mask is not something that is required for people who are home, who are going out to buy the groceries or sabzi khareedne aa rahe hain. So they don't need to wear an N95 mask. For them, even a surgical mask or a homemade mask is fine. If you are a healthcare worker, if you're a doctor, nurse, you're working in the healthcare service, or you're working with, I would go even a step ahead. If you are somebody who is still working like we are, and you are exposed to a lot of different kinds of people every day, you're a shopkeeper, then then we can justify you wearing a N95 mask. But for all the other people, a homemade mask is actually sufficient. It will do the trick. It's simple to use. Just wash it in your regular soap and water. And you don't need a surgical mask either.
Yeah, and I'll add to that. I think sanitizing the masks. So when people make masks, they should make enough of them, and very simple. Wash it in soap and water and hang it out in the sun for 4-5 hours. That actually helps get rid of the a virus. The other way to sanitize is to actually put it in a pressure cooker and boil it for 10 minutes. So that's another very simple way. That way the virus completely gets killed and they can use it again. So again, homemade masks, it's a request actually. Stick to homemade masks.
Right.
For healthcare workers, they're right in the middle of it. They're having a very close exposure to such patients. So it's important that we have enough for them. So while we are going out for simple grocery shopping, I think let's stick to the regular masks. But of course, for hospitals and all, we have the surgical masks. Even the surgical masks, a lot of people are using them. Do not use them, because one single use, it's actually useless then. The one surgical mask actually gets wet. There's no point.
You cannot use it again.
And people use it for days and days and days. So that's actually worse than not wearing a mask. So it's a very thin line, so people have to understand.
Yes. I think, both of you are the healthcare heroes that, all of us must salute. You're still working. It takes a lot of bravery, a lot of courage and strength. And, thank you from the bottom of my heart. And I'm sure all of, the people watching are very, very grateful to you for actually continuing to do this. But still, what we find is that there's a huge inequality right now on people who have access to these things, these masks, these sanitizers. There are a lot of, hospitals in different parts of the country. In fact, many parts of the country don't even have access to healthcare. So maybe one of you, would want to make a comment on, do you think that the Indian healthcare ecosystem, is it ready to deal with everything that's coming?
I think at this point, we are trying our best, because somewhere we always knew that maybe we cannot deal with it. That's the reason a lockdown has come on in the first place. And that's why even, right now the government has extended the lockdown because somewhere we know with a population of 1.3 billion people, if we start getting sick at the pace of how US has gotten sick or how Italy people have gotten sick,
Yes.
if that happens in India, it can go out of control. And yes, I think the government is trying their best in whatever capacity they can. And of course, we can always find faults, but it's not easy in our health system. I think it's a lesson in a way for just in general that how much we have to improve our health system to deal with it. That being said, I think if the lockdown is followed and everything is done to the maximum, but of course it's a very difficult decision, because a lot of people who are suffering as well because of the economy and they don't have jobs and the daily wage work. So you feel
Exactly.
people are hungry. So it's a very difficult decision at this point.
Very tough.
Very tough. And I think there's no right answer, honestly. Because
Right.
we gain some, we lose some kind of a situation, unfortunately.
Yes. I mean, Bill Gates also, famously said a few years ago in his TED talk that we are, we need to be more prepared for epidemics. We need to be more prepared for pandemics. And pretty much no one heard that. A lot of countries have made more investment in their defense. And yet the strongest countries which have the best defense system don't have enough defense against an unseen, invisible virus. So I guess that, goes to show.
Very humbling, I think.
But
yes,
I'd like to add that this virus has crushed, I think, every country it has gone into, whether it's Europe, whether it's China, whether it's America. Some of these countries have had healthcare systems that we admire and we want, and even they have been crushed by this virus because nobody really, nobody really appreciated the way it would spread and the calamity it would bring. So I think we in India, I would like to say this, exactly what Sonia said, that, I think it's been fantastic that we are on lockdown. So at least we have been able to mitigate, to slow the spread, trying at least slow the slope of the curve, and that also buy additional time to get our resources ready. The way the government has gone and taken the hospitals, those railway bogies we read about on
yes.
some of the newspapers. I think that's all brilliant. I think they're doing a fantastic
it's
job.
It's really amazing. I mean, and I would say that this is such a leveler of sorts. It's like the richest of the people, the most royal people in the world, Hollywood actors, Bollywood. I mean, right to the person on the street. Nobody is immune to this. It's such a leveler in our time. And I think the reason why people are so affected is because it really hits home. It really impacts our day-to-day lives right now. And coming from that perspective, even our daily items, that we are going out to the grocery store, like you said, many people, one person in the house has to go out, get these groceries. So even in these daily, chores, when we get things from outside, different delivery services are opening up. So what should be the best way to deal with the items coming from outside? This might be a very simple question, but it's something that everybody wants to know.
Absolutely. And I just got groceries today. Before I came back home,
okay.
I bought vegetables. So absolutely. Right. And everything I was touching for a second, I was like, so the most important thing is if you go to the grocery store or when you go to buy vegetables is whenever we touch anything. So that is the key time. Please do not touch your face. I think everybody needs to remember that. Because it's human nature, we touch our face at least 2,000 to 3,000 times a day. We just keep on touching.
Wow.
Right? And it's just so natural, and we don't realize it. So especially when we go out to these places, we have to be very careful. So whenever we are handling these products, be as careful as possible. Once you're back home, a simple thing that me and Sameer we made like a dirty zone and a clean zone. So we get our vegetables, or we put everything in the dirty zone first, and then for our vegetables, for example, you want to wash everything in running water for at least 20 seconds. If somebody has a water shortage, they can even take, like a bucket, put water in that and soak the vegetables in that for a bit so that they can wash it off. Let us suppose if you have vegetables that are a little bit like bitter gourd, they say Karela, like that's a little more firm and bumpier skin, that they should actually scrub with a brush to ensure that vegetables are properly clean.
Okay.
Another simple solution is people can buy potassium permanganate and make a solution out of that, and even rinse their vegetables in that, and that also helps disinfect.
So I think quite a few people are trying to now rinse their vegetables when they buy it. So that's a great input. I think a lot of people will find it useful.
Yeah, and once they wash the vegetables, make sure you don't touch your face again. Make sure you wash your hands.
Of course.
Again, people forget that. So that's right.
No, people are saying that you should wear face masks just so that you don't touch your face.
Yeah, I think that might be
yeah.
one way.
Not touch your face. Exactly.
And then for
Yeah.
boxes or whatever cereals or anything else you get, just make sure you
Yes.
have a sanitizer and a wipe, and you can just wipe them out and leave them for 10 minutes. Or use a soap and water solution, or even
Okay.
a bleach solution. You can put like 100, like a small, like 100 ml of bleach in like
Right.
a 1 liter of water. Make a 1% solution. Just wipe the boxes with that. Leave it, and then you can obviously use it if something emergent. Some people are doing is they don't touch their groceries for 24 hours, and only after 24 hours they actually use it. So that's
A lot
another
of people are
way.
doing that.
Yeah.
Leaving them.
Yeah, but
Yeah.
You know,
But
leaving
I
them-
feel that you should still disinfect them irrespective of,
Sure.
of even leaving them for out. But as long as you wash your hands before you eat, before you touch, after you touch anything, I think it should be fine. I think that's why people have to be. There is no data to show that you can get it from groceries per se, but
Yes.
you do not know who else has touched it. Maybe somebody sneezed on this box of fruits, whatever you're eating.
Sure. Yes.
You want to wash the vegetables and fruits before you eat them, and the boxes as well.
Yeah, and I think also, in the whole frenzy of, protecting themselves, people are taking a lot of these hygiene precautions, which in the Indian culture, hygiene is not our forte, I would say. But I think, we are doing a great job now. Everyone is washing their hands and disinfecting everything. But one more thing that people are doing, and I know that some people did, was that they took the flu vaccine. A lot of people were also rushing for that. And a lot of people who can afford it, obviously, have bought vitamins, immunity boosters, like a bunch of these things, right? So, maybe Dr. Sameer, you can give some input on this thing. That first of all, does the flu vaccine prevent us from coronavirus, and do these immunity boosters really work?
So, as far as the flu vaccine is concerned, the answer is probably not. It doesn't give you too much in terms of benefit, because we can see that in America, right? And we can see that in some of the European countries.
Absolutely.
I mean, if you live in America, then, pretty much everybody gets the flu vaccine every year. I, as a healthcare provider,
Annually.
I when I was in America, I used to get the flu vaccine every year also. But you're seeing so many people over there still with the virus, right? So I'm not sure if it really helps them too much. So I would doubt if the flu vaccine per se would give you some benefit. Now, as far as other immunity boosters are concerned, immunity boosters, vitamin C and all these different vitamins, multivitamins, there might be some benefit in them. It's not that, oh my God, it's a life changer. It's not going to be any of that stuff. But there are other simple things that you can do to improve your immunity, to reduce your chances of getting very sick with the flu, or at least mildly sick with the flu also. Improve your innate immunity, as they say. I mean, the vitamin C is definitely something which has been talked about. You can take whichever, adrak or tulsi or whatever else you want to take. But other things that you can do is you can eat healthy, right?
Yes.
Eat healthy. You're at home, have good food, good nutritious food. Don't have too much in terms of pakoras and samosas. Try and eat some good nutritious food. Sleep. Sleep is very good. It's an immunity booster. Get good 7 to 8 hours of sleep at least. That's good for you. And exercise. Exercise there is a lot of data for all these three things, whether it's sleep, food, or even exercise. If you can exercise, I know you're homebound, whether you go on the terrace, whether you go on your balcony, you just turn on TV and do yoga. So there are multiple things and ways around it. So I think these three things are probably going to help you more than any immunity booster, more than any Chyawanprash or anything else. Is trying to build resilience
I'm so
inside
happy
your
you're saying
body.
that. Because we as at Health at Go, we keep on telling parents and children that every day you have to exercise, and they cannot understand why. They say, oh, we don't want to lose weight. But I think the real correlation, what you are saying, it's not about losing weight. It's actually about maintaining a physically healthy body, and sleep and exercise and healthy eating all correlates to that.
Absolutely.
And I think this is where people are seeing the difference between health for looks or vanity versus health for health's sake.
Exactly.
So Priya, I'm a cardio.
Yeah.
So Priya, I'm a cardiologist and Sonia is a neurologist, right? And we both see these kind of people every day, right? I mean, hypertension, diabetics, family history of heart disease, heart attack. We see this every day. High cholesterol. People saying, मैं तो कुछ खाती नहीं, मैं जी आपका वेट, आपका BMI तो 32 है, 33 है, कि मैं तो कुछ खाती नहीं, I don't eat these things, बस हो गया,
Exactly.
you know. So you know, I think it's important to remember that these things increase your risk of heart disease, they increase your risk of this thing, and it's not, and when you have a heart attack at the age of 60, it's not anything you did that day. It is everything you've done when you were 20. From
Yes.
20 to 40 years, 20 to 60 years, those 40 years, all the bad habits have added up and led to that event when you were 60. So that is something for you to remember, in all the watchers, all the viewers.
Yeah, and I think one more thing I'll just add for the flu vaccine is
Yes.
let's take an opportunity to stress upon the fact now we have this entire world waiting desperately for the COVID-19, the coronavirus, vaccine.
Vaccine.
When will it come out? Oh, 12 months is far away. And we forget there's another flu that we all deal with, and India deals with every year. We have thousands and thousands of cases, and actually people die from it. Young people are also dying from it. And that's the swine flu, the H1N1,
Yes.
So there is a flu vaccine for that, and I think people need to realize the importance of taking it. Here we are waiting for something that doesn't exist, while we do not even take the advantage of protecting ourselves from something that does.
That is such a poignant point because, I'll tell you, last year I got H1N1 and I had no idea that I even had it. Very similar, I guess, how these coronaviruses they actually work. You don't realize because your symptoms are so close to something else. Right. And when I got H1N1, of course, I had been ignorant of the fact that I should have got the vaccine because it's been available. It's quite an old disease, right? Swine flu in that sense. But still, people are not aware and taking vaccines. And, I thankfully, came out of that quite okay. But still now I'm more, vigilant on this, that as soon as I get the next opportunity to get vaccinated, I will. But this message that you've just given, I think needs to reach out to a lot of people that the existing vaccines also, people have actually not taken.
Exactly. So people have to protect them, not just from COVID. I think people have to protect them from everything. Hand washing is important, not only because of this particular, it's important actually to protect you from typhoid. It's important to protect you from any foodborne illness. It's important to protect you from any other droplet infection. So I think for, kids who are listening, this as well, I think it's important for them to understand that wash your hands as much, before you eat, and that is extremely important. Parents tell you, wash your hands. There's a reason for it, and that there is something they have to follow, even in school. I think in school, children don't follow that as much. At home, they still would, but when you're eating it out of your tiffin box, you finish your class, you just open it up and you're just gulping.
And you just eat it. We all have done that.
We all have done that. We all are guilty. But I think that's when our children have to start taking those precautions as well. I think that would be.
So anything specific you feel that for immunity, if you had to give, maybe any kind of recommendations in terms of a lot, vitamin C or any other vitamin or mineral, would there be any top 3 that you would probably recommend to people?
So vitamin C is the only one that has some data that it's a good antioxidant.
Okay.
But apart from that, really, we don't have any evidence for anything else. So vitamin C, in small amounts is fine. But I think as Sameer mentioned, the key thing is actually having good nutritious food and having, for anybody who can have, your fruits and vegetables. They're the best source of antioxidants, best source of, anything possible. And people have to remember not to processed food. I think the habit of having a lot of processed food is also overtaking India to a large extent. And people who are sitting at home during the lockdown are also having a lot of processed food.
People at home in the lockdown, I think, we're all becoming cooks and chefs. Yeah. But the cooks and chefs and bakers of chocolate cake and pizzas and burgers. Exactly. So I think a lot of, people need to realize that the lockdown is a time also maybe to change their habits, which they've been having, for a long time. And interestingly, they say, I don't know how true it is, that it takes 21 days to form a habit or maybe slightly longer. And we do have that time thanks to the lockdown. So if people take that time to probably change their habits, hopefully we can get healthier people out of this lockdown period.
Yeah, absolutely.
I think we definitely should. I think that should be the goal for everyone.
Those 3 things, Priya: diet, exercise, and sleep.
I think that's a life advice,
Yeah,
not
that's
only
right.
COVID advice.
Yeah.
And I mean, I was just reflecting on the kind of patients that you look at, every single day. And unfortunately, I guess in India, especially, people come to doctors at the very last, when things are, getting to a stage where they can't even manage it themselves, whereas they could have taken action way, way before. So I think this just goes to show that, people really need to use this as a wake up call. Right.
absolutely. Absolutely. And people should also
Yeah.
remember not to smoke. COVID
Yes.
actually found to affect smokers the most. So that's actually a very key
Because
point.
it's a lung disease. Is
It's a lung
that the
disease.
reason?
It's a lung disease. It affects the lungs, and people who are smokers are actually prone to it even more. So that's why it's extremely important that they do not smoke. So that's, I think, key thing to remember, that that do not smoke. And
I think that's a strong message because India has one of the highest rates of tobacco usage. So, we do have like a lot of people saying that, it doesn't really matter, but it does, because that this disease is directly affecting the lungs. So yes.
absolutely.
So, coming to a final, future looking question, how do you think, life is going to change for all of us? Of course, I'm asking you to be an oracle of sorts, but I would like both of you to chime in on this. How do you think life will change after COVID?
I think Modi put it very well. He said in one of the interviews, he said, when you look at the history of the world, it's like the world before World War II, the world after World War II.
Hmm.
It's going to be the world BC, right? Before COVID, and now it's going to be AC after COVID. That's how we're going to identify the world. But and it's just not that, on the 3rd of March, 3rd of May, supposing the lockdown is lifted or partially lifted, oh my God, the virus is gone. We're all free. Let's go out in the street and celebrate like India just won the World Cup. Let's not do that. It'll have to be, you have to be cognizant. It'll be so slow. People will still be concerned about going in big, large public settings. They'll still think twice before taking an airplane flight. Is it really required? Do I have to go? Do I really have to go to a public gathering? And that's how it should be also, rightfully so. It's just not that the government has lifted lockdown, because, Priya, never in the history of mankind, at least in my living time, have we ever been in a state where I have been dependent on Priya for my wellness and Priya has been dependent on me for her wellness? Because if I don't take care, I can spread the disease to you. And if you don't take care, you can spread the disease to Sonia. And that's how the circle goes. So we all have to come together as a community to fight this. And that's very, very important for everyone to understand.
Yes.
Yeah, absolutely. And I think we just did it perfectly. I think the world will change. I was looking at some old videos, and the way humans love to interact. And now everybody's sitting in their homes, and people don't even know how to live with their families, I think. So this is like a test for everyone to even live together. And now coming out of it, either you'll have strong bonds also, but at the same time, I think people are going to be scared. Do we get to the public gathering? And I think that fear, when can we break that fear? Will it actually take us a year and a half till the vaccine is out for us to live normally again? Will we continue using the mask even after the lockdown is lifted? And I think that's a big possibility, that the usage of masks, as in cotton masks, regular, your scarves, anything at all, I think that might probably continue. I'm sure most of us, when we fly after this, we will have a tendency to use a mask, right? That we do not want to get infected. So I think definitely awareness and a fear, and somewhere human relations will change. I don't know, being maybe very philosophical, but I feel that at a certain level, the way people interact, that will change. And
fundamental change. Yes.
Fundamentally, there will be some fundamental change. And I think students are experiencing that. I think staying at home and doing these online classes, but they miss meeting their friends. They miss playing with them. And, and that is something, people, one of our nieces, she put on it. She's like, I feel I've not seen my college life. She just started a few months ago, and now she's stuck here in India. So she's miserable. Yeah, so I think human touch and human interaction is something. It'll be interesting to see what happens post the lockdown and post this whole.
Yes, I mean, again, both of you have been, spreading the right information, going out to these platforms and saying the right things. I think that's what people need to hear. more verified information, and really to understand that at the end of the day, they are in control of taking care of themselves and taking care of people around them. So I would really like to thank both of you for being here and having this conversation. Of course, it was full of a lot of basic questions, but I think it's something that everybody needs to hear again, and everybody will truly appreciate. So thank you so much for being part of this, and hope to interact with you at some point soon again.
Thank you so much for having us.
Thank you for having us.
Platform. Thank you.
Thank you.